Hi, this lesson is on Chapter 6 from Healthy Living, which will cover romantic relationships and sexuality. Relationships do play a role in our overall health, and so we'll talk about them as part of holistic health. So sexuality encompasses an individual's sexual thoughts, feelings, attitudes, actions, and it's influenced by biological, psychological, social, and cultural forces. It's woven into every aspect of human life and affects a person's identity, self-esteem, emotions, personality, relationships, lifestyle, and overall health. And we've talked about some of those things already in previous chapters. There is a figure on page 170 in your book that shows the many influences on sexuality. So unlike other animals, humans exhibit a variety of complex sexual behaviors that don't necessarily result in reproduction all the time. So the biology of sexual behavior includes the libido or sex drive, which is the motivation to pursue sexual activity. The glands of the endocrine system produce hormones, which are chemical messengers, and they play a role in sexual behavior. And the testes and ovaries, the male and female sex organs, produce different hormones that affect sexual functioning. In males, it's testosterone, in females, estrogen and progesterone. There is also a psychological component of sexual behavior as well. So besides the hormones and the biologic part of it, there's thoughts, sensations, and emotions that play into sexual behavior as well. So sexual responsiveness can be influenced by satisfaction with one's own body, your physical and your emotional health, your beliefs, religious, cultural, societal beliefs, previous sexual experiences, as well as self-esteem. So the sexual response is governed primarily by the nervous system, but like I said, there are other factors that play into that as well. Testosterone maintains the sex drive in both males and females. So while it is primarily a male sex hormone, females do have testosterone as well. The two major changes that happen during sexual arousal are vasocongestion, and that's when the spongy tissue of the penis and the clitoris expand with blood during sexual arousal, and myotonia, which is an increase in muscle tension or tone during sexual arousal. Two fairly famous psychologists, Drs. Masters and Johnson, came up with a 4-stage model to describe the sexual response. And that includes the excitement phase, where there is heightened sexual awareness, the plateau phase, where we see an increase in heart rate, blood pressure, respiratory rate, and muscle tension. There is the orgasmic phase, which is caused by rhythmic contractions of the muscles of the pelvis and sexual organs, followed by a period of relaxation, which takes us into the resolution phase, where the body returns to the pre-arousal state. So this is a diagram of the Masters and Johnson model, and if you look at females versus males, the male response is fairly regular. There is a bit more variability in the way that females respond to sexual behavior. There are some other sexual response models as well. Whipple and Brash-McGreer had a more circular model of female sexual response. They used a lot of the ideas of Masters and Johnson, but they recognized that pleasure and emotional satisfaction from one sexual experience can lead to desire for another sexual experience. And another researcher, Basson, developed a cyclical model also of the female sexual response, which also incorporates emotional and psychosocial aspects as well. And we are often told that females have a more emotional connection and emotional response to sexual behavior than males do. There is a figure on page 175 in your book that depicts this second cycle. So some people may be affected by different sexual dysfunctions. The first one, these first two we'll talk about, happen in males. The first is erectile dysfunction, which is abbreviated ED, or sometimes called impotence. It's often a physical problem, although there can be some other factors as well. but it's characterized by the inability to achieve or maintain an erection. It could be caused by things like blood vessel disease, which is actually the most common cause right now, and especially with the increased rise in obesity and cardiovascular disease in the United States, we can see how this could happen. It could also be caused by nerve damage, excess alcohol consumption, or certain medications. It does increase in incidence as men get older. The next condition is premature or rapid ejaculation. It is the most common male sexual dysfunction, and it affects anywhere from 20 to 30% of men of all ages. The cause still isn't 100% known, although they are looking a little bit more now at biological factors more so than psychological factors. Therapies may be helpful. There are some medications that can help with this, as well as counseling. Hypoactive sexual disorder is a low interest in sex or a low sex drive. It can happen in both sexes, and there are typically both physical and psychological causes. It can be things like restrictive views about sex, a history of sexual abuse, relationship problems, chronic diseases or conditions that can decrease sex drive, fatigue, stress, illness, and abnormal hormone levels as well. It does affect women slightly more often than men, and some of the available treatments are, again, once the cause is identified, trying to eliminate that, relaxation techniques, hormone replacement therapy, adjusting medications that the patient's taking. Those things may help. These conditions occur in women. There's female sexual arousal disorder, which is the inability to obtain sexual pleasure from stimulation, and the inability to maintain arousal during intercourse. Postmenopausal women are most likely to experience this female sexual arousal disorder. There is another condition called vaginismus, where the lower portion of the vagina contracts involuntarily at anticipation of penetration, which makes intercourse painful. There are physiologic and psychologic causes, and there are treatments available for this as well. Society strongly influences sexual attitude and behaviors by identifying acceptable sexual activities and restricting others. A value is a belief that an idea, object, or action has worth. The value system is a collection of beliefs that helps a person to identify things as either good or bad, or neither good or bad. Because our population is so diverse, you're going to see a vast variety of sexual values. There is no universally accepted set of sexual values that applies to all Americans. So we're going to talk a little bit about gender and gender roles, gender identity. Gender identity is an individual's perception of his or herself as either male or female. And so there are some different terms that we're using now to sort of describe someone's sexuality. You may be familiar with these, you may not. But cisgender means that gender identity is the same as the biologic gender. So that means someone is born a female and they identify as a female. Transgender is when the gender identity doesn't match the person's biologic gender. So maybe the person was born a male, but they identify more as a female. And then there's gender queer, where they're not categorized as either male or female. They might be a little bit more changing, a little more fluid. It's hard to describe their sexuality. Gender role is a pattern of behavior, attitudes, and personality attributes that are traditionally considered in a particular culture to be either masculine or feminine. And then gender stereotypes is the widespread association of certain perceptions with one particular gender, like a male role or a female role. Transgender, like I mentioned previously, it's a kind of an umbrella term that's commonly used, but it's not universally accepted. for various groups of people who don't necessarily conform to traditional gender roles. So again, don't necessarily associate with being male or female, or whose gender identity differs from the societal norm. Gender expression is the external manifestations of one's gender identity. So how you sort of express yourself, how you dress, how you carry yourself, how you appear, your outward appearance. There is a table on page 181 to 182 in your book that goes over a lot of these different terms, and sort of gives a definition of each one or each term there. Again, some are becoming more outdated, some can be a little bit more offensive, so it's really best to just kind of talk to somebody, ask them, sort of what pronouns do they want to use, how do they want to be addressed, to make sure that we are respecting their gender identity and expression. Sexual orientation is the direction of one's romantic and sexual thoughts, feelings, and attractions. So who are you attracted to? Asexual means that there's no attraction to anyone. Bisexual means that you are attracted to both sexes, males and females. Heterosexual means that you're attracted to the opposite sex, and homosexual means that you're attracted to the same sex. According to sexologist Alfred Kinsey, sexual orientation is actually a continuum. So it's not quite so black and white, is what he's saying. And that's actually figure 6.6 in your edition of the text now, and it can be found on page 185. Some people have gotten into the debate of nature versus nurture as far as sexual orientation. But most mental health experts agree that homosexuals don't decide, or really any people, you don't really decide your sexual orientation. You just sort of have these preferences naturally. As far as society, homophobia is the intense fear or hostility towards homosexuals. As of 2015, all states in the United States did allow for same-sex marriage, and as of 2018, 26 countries allow same-sex marriages as well. So up until that time, marriage wasn't legally recognized between same-sex couples. Some common sexual practices between partners: sexual intercourse or coitus, anal sex, petting, which includes kissing, fondling, and oral sex. There is solitary sexual behavior, which we often refer to as masturbation. And then there's celibacy or sexual abstinence, which we mentioned in the previous chapter, which is just not participating in sexual intercourse. So defining love, this is very difficult. It has different meanings to different people. So one definition is that love is a collection of behaviors, and I do believe that is certainly true. It's not just one thing, but it's behaviors, thoughts, emotions that are associated with a psychological attraction to another individual. No matter sort of how you define love, it typically involves the element of caring about another individual. Some terms that usually play into love or loving relationships are intimacy, where one can disclose their personal thoughts and emotions to another individual who they trust. Attachment is the desire to spend time with someone to give and receive support. We see that a lot with children. Commitment, determination to maintain the relationship. Affection is a feeling of fondness, and respect is feeling that that other person has value and deserves attention. So just for a second, think about how would you define love? So again, loving has characteristics of intimacy, attachment, caring, and commitment, all those things that we just talked about on the previous slide. Liking is usually considered a lesser step than love, but it includes affection and respect. And love that is fulfilling, or some aspects of a healthy relationship, is when it is reciprocated, meaning you give and receive, allows partners to achieve self-actualization, so each person is the best version of who they want to be. fosters mutual independence, where one person doesn't necessarily depend more on the other, and fosters emotional, social, and spiritual growth. There are some different theories about love, and looking at the idea that humans are social beings with distinct personalities and how they might be attracted to different people. A researcher, Eric Fromm, suggested that loving is an art that has to be learned and practiced. Later on, John Lee Allen theorized that there were 6 styles of loving that exist. In his theory, you can see on page 189 in the text. But most people or most relationships don't fall into just one of these categories. There's usually sort of a combination of a few. In 1986, a psychologist named Robert Sternberg created a triangular model of love, which looked at intimacy, commitment, and passion, and then how those 3 aspects of relationship are balanced sort of affects the area of that triangle. And then he found that couples who have similar triangles or who sort of value the same things are more likely to be satisfied with their relationships. So we mentioned attachment earlier, and again, that's the desire to be close to someone or seeking attention. And it's a biological drive in children where they want to be near or in contact with a specific person when they're under stress. Typically, the first forms of attachment children form are with their parents. And so if a child lives with an emotionally distant or neglectful parent, they may mature into anxious lovers. If children have poor attachments with their adult caretakers, they may avoid becoming emotionally close to others as they get older. And children whose caretakers have actually met their emotional needs are more likely to display affection and mature into secure lovers and typically have more healthy romantic relationships. Love does change over time. Early in a relationship, passion is high. They call this kind of the honeymoon phase. And that infatuation is passionate, but it's unrealistic. People usually don't know a lot about each other at that point in time. It's a lot of physical attraction, maybe not as much emotional or intellectual attraction at that point. But then after that, that intense sexual attraction subsides a little bit, but the companionship deepens. Conflicts may occur, but people who are committed to the relationship will try to work through it and resolve those problems. So over the course of a long-term romantic relationship, the phases are going to kind of come and go, and change is going to occur. So to establish a romantic commitment or relationship, there does need to be physical attraction, and studies have shown that that is one of the most important factors. That's usually the initial factor. If there is not physical attraction, then typically a relationship does not form from that. Compatibility is the ability to exist together in harmony, and some of the most important compatibility factors are going to be closeness in age, which doesn't have to be right on, but the further apart in age people are, the more likely they are to be incompatible. Having similar racial, ethnic, religious, and educational backgrounds, and sexual satisfaction. And again, these are some of the components of a sustainable long-term relationship. Some types of romantic commitments include cohabitation, which means living together, but someone who's not married. It is becoming more common nowadays. It's common among heterosexual, homosexual couples. There are some conflicting results regarding cohabitation, but it has also significantly increased in people over the age of 50, which they believe is also related to the increased divorce rate in that age group. Marriage is a legally binding commitment between 2 adults, and more successful with positive problem solving and communication skills, open discussions of feelings, willingness to negotiate and compromise, sharing the same values, having mutual concerns, and having high degrees of physical intimacy. On average, Americans are marrying later now than they used to. The average age is 27.4 years for females and 29.5 years for males. Another type of commitment, I guess, is extra-relational sex, and that's where people have sex with people outside of the marriage, people who are not their spouses. This is not commonly accepted by society, and we'll talk about divorce rates and things like that in a little bit. So with marriage, again, sometimes can come separation or divorce, and some of the common causes of that include extramarital sexual activity, right? So most people don't accept that. Emotional immaturity and alcoholism or other types of substance abuse. Nearly half of all recent first marriages end in divorce. It is usually due to more than just one factor, though. Communication is really a big piece of maintaining a strong, healthy relationship. And so to have effective communication, it is important to say exactly what you mean and not assume that the person you're communicating with or your partner knows or can read your mind. So it is important to state your feelings. Make your statements specific. Don't be vague. Don't generalize. Say what you mean. Avoid sending mixed messages. Use I statements. Say, this is how I feel. Don't say, this is the problem that you're having, right? So take responsibility, put things on you, don't blame the other partner. Listening is a big communication skill as well. So listen with attentiveness, openness, and patience. Hear the other person out, see their side of the story, and observe for non-formal forms of communication as well. Read a person's body language. So across the lifespan, sexuality. A lot of preschoolers will masturbate. They'll act out older adult gender roles. They do typically model what they see. So whatever they see in their guardians, parents, caregivers, that's the kind of actions that they will start to model. Elementary school children may engage in mutual sex play, which can be normal as long as it's playful, it doesn't happen all the time, and it does not involve any type of coercion. If so, then it is certainly a bit more problematic. As children get older in the teen years, peers, media, older people sort of put some pressure on aged kids to have sex. And so despite efforts to promote abstinence, about 40% of American children have had sex by the time they graduate from high school. So gender, age of puberty, ethnic groups are associated with virginity loss. Religious affiliations, sex education, grade average, and self-esteem are not. I thought that was kind of interesting. Teenage birth rates in the U.S. have declined in the 21st century, but it's still higher than a lot of other Western industrialized nations. There are also disparities by race and ethnicity. Minorities do tend to have slightly higher teenage birth rates. And then as we get into the older years, sexuality does not necessarily have to come to an end. Inactivity is usually due to medical disabilities or a lack of partner rather than a lack of desire. Older adults do experience a gradual decline in sexual functioning. It does take longer to become sexually stimulated or aroused, and medications like high blood pressure medicines, antidepressants, which a lot of our older population are on, can decrease sexual functioning. So sometimes that just needs a chat with the doctor to adjust medication levels. So that's it for this chapter. And again, as always, contact me with any questions. Thanks.